began working with Coherent in Namusita. We found a lady who carried out unsafe abortion using local herbs. She was taken to a nearby clinic and they failed to help her because they could not handle her complications. We found her in her home in a critical condition after the unsafe abortion at her home, and she couldn't see anything. I thank Coherent for taking that time to rescue the patient who was on her deathbed and rushed her to the hospital.
This is an example of a woman among the hundreds who, because of desperation we have met in the community, that almost lost their life because they couldn't exercise their reproductive rights and bodily autonomy. Such cases and worse are highly mushrooming in the community grassroots in Uganda. The lack of adolescents, young people and adult women to exercise their reproductive rights and bodily autonomy is being fueled by beliefs and norms, leading to the mushrooming unsafe abortions, violation of reproductive rights, and lack of recognition for women's bodily autonomy among the vulnerable and marginalized adolescents in the project areas. Due to stigma as a result of political, religious, and culture, have hindered the adolescents and young women to freely exercise their reproductive rights and bodily autonomy. Because of stigma attributed as a result of the above, many of these target groups have resorted to the use of clandestine means to terminate pregnancies, but also to use unapproved measures to prevent unwanted pregnancies. Nevertheless, if they are to do it, they do it in hiding. Through closing the reproductive equity gap for women's bodily autonomy project, we are strategically and systematically working towards the reduction of stigma using different strategies. These have included value clarification and attitude change. Another strategy, the Community Repro Health Parliament. We are systematically and strategically involving political, cultural, religious leaders and general communities to ensure that they understand the need of recognition of women's reproductive rights and bodily autonomy. Violation of women's reproductive rights and bodily autonomy has resulted into mushrooming consequences of death and lifetime injuries as a result of clandestine unsafe abortions. Because leaders can no longer handle the consequences of violations, thus calling us to intervene and do our work without fear.
It calls upon the leaders to ensure that we do a lot of sensitization of people. Very few people know their rights.
If we deny young women family planning services, they will get teenage pregnancies, yet most of them are afraid of disclosure or informing their parents. Most of them end up resorting to unsafe abortion and die during the procedures. We were informed that the government spends a lot of money on a person that has carried out unsafe abortion.
Despite the fact that stigma labels are still in existence, it is not yet a bed of roses. We believe it is just our beginning, continuity and consistency that will in the end result into empowered women and communities that can fully support the recognition of reproductive justice and women's bodily autonomy. Women's reproductive rights and bodily autonomy matters.